Hi, my name is Beth. I am a BCIT perinatal nursing student. I'm going to do some teaching on jaundice and inverted nipples and how you can support the mother and babe experiencing both of these unique challenges. We can use the situated decision-making framework to support our practice. This framework involves knowledge, judgment, decisions, evaluation of outcomes, and cues. Knowledge refers to knowing yourself and your strengths. How much information do you have on this problem? Have you experienced this problem before? What are your limitations? Also, it refers to knowing the case and pathophysiology. We will look at pathophysiology later. It also involves knowing the client. Cues refers to observations or variances that you observe. In this case, you would observe jaundice and inverted nipples. You can look at the breasts and see inverted nipples. Is there milk? What else can you look at? What other information can you get from looking at the breasts or the mother? You can look at the baby and observe the latch. You can look at the feeding relationship. Is the mother and the baby comfortable? Is there skin to skin? You can look at lab data. In this case, the ability level would be important. Jaundice can affect how well the feeding goes. You can look at the output and weight, and you can look for evidence of milk production. Judgment refers to evidence supporting your actions. You need to look at what could be happening. What is the background information? Decisions refers to how can we help the mother in this situation? What action should we be taking? Evaluation refers to the outcomes. Did we achieve the expected outcomes? In this case, the ability level should be improving, and we should be observing effective feeds. The latch should be good, the mother and babe should be comfortable, and they should be breastfeeding effectively. With breastfeeding challenges, we can use the situated decision-making framework to support our practice. This framework involves knowledge, judgment, decisions, evaluation of outcomes, and cues. Knowledge refers to knowing yourself, knowing your strengths and limitations, and knowing the case and pathophysiology, and knowing the client. We will look at pathophysiology later on in the presentation. Cues refers to observations or variances in the case. In this case, jaundice and inverted nipples are observations we have made. We can look at the breasts, we would see inverted nipples. Is there milk? Is another important observation we can make. We can look at the baby, we can observe the latch, the gestational age, any other factors that would interfere with breastfeeding. We can look at the breastfeeding relationship. Are the feeds comfortable? Is there skin to skin? We can look at lab data. In this case, the ability level would be important. Jaundice can affect how well feeding goes. We can also look at the output and weight from the baby. And we can look at, is there evidence of milk production? Judgment. What could be happening? What evidence supports our actions? Decisions. How can we help the mother in this situation? What action should I take? And finally, evaluation. Did we achieve our outcomes? Is the ability level improving? are effective feeds observed? How is the latch? We will use this tool later on in the presentation when we're looking at inverted nipples and jaundice. In any breastfeeding situations, we can use the 3 E's and the 3 rules. The 3 E's are early and often. This means skin to skin within the first hour and attempts to breastfeed often. The second E is effective. How is the latch? How is the technique? Can you observe milk transfer? The third E is exclusive. This means no supplementation. The goal is for the baby to be 100% breastfed. The 3 rules are pretty similar to the 3 E's. The first one is feed the baby. Is the baby feeding effectively? These are all observations you can make. Is there milk transfer? Is the latch good? How is the technique? The second rule is move the milk. This involves supply and demand. We want to make sure the breasts are emptying because that will cue the body to make more milk. The third rule is help the dyad learn to breastfeed.
Now we're going to talk about flat
This
nipples.
means teaching the mother
you can use the information
and having a positive environment.
Neonatal jaundice.
It also involves
with
patience
this
and reassurance.
And you can use the treatments together when you're dealing with the mother-infant dyad who is experiencing both of these challenges. So flat nipples just means that the nipple is flat or inverted at rest or when touched. So it's just another variation of nipples. All breasts are different and there's no real cause or reason for the mother to have this. It can present some unique challenges when teaching breastfeeding. The treatments involve getting an effective latch and basically the end goal is for the mother and infant to be comfortable breastfeeding. So we want to encourage the mother and infant to attempt to breastfeed often and early. We want skin to skin within that first hour. We need to support the infant's attempts to latch. So basically we want to help the mother get comfortable, help the baby get comfortable, and help the baby get that nice wide open mouth and latch onto the breast. So we can teach the mother to either use a pump or hand expression prior to feeds. Sometimes this can draw out the nipple, which will help the baby latch. It's not always effective, but if we keep encouraging it, eventually that nipple should draw out. We can do hand expression and cup feed until the latch is effective, and we can teach the mother how to do this early on. It's important that that baby's getting that colostrum and that breast milk early, and the most important aspect is patience and time. Flat nipples is a unique challenge, and we just need to encourage skin to skin, get that baby to the breast, and that's our part. There are some techniques that are not proven, but the mother may want to try. She may want to try a nipple shield. So this is just a plastic rubbery device that goes over the nipple and can stimulate a non-inverted nipple. Sometimes that can draw the nipple out, and then you can get the baby to latch once taking it off. Again, this isn't proven. There's no studies to prove the effectiveness. There also is the Hoffman technique, which is a series of manual stimulation. You can look that up online, and you can give that a try. Okay, so now we're going to look at observations, and this relates to the evaluation of the effectiveness of what we have attempted. How is the baby's weight? Is the baby's weight less than 10% weight loss? Is there milk production? Are the infant and mother comfortable with breastfeeding? Do we observe a good latch? Is there milk transfer and swallowing? So you can hear the swallowing when the baby is getting that milk transfer. And is the belly level improving? Is there urine output? And is there meconium output? Hey guys, it's Beth again. So we're going to talk about newborn jaundice. This is a type of jaundice that is specific to newborns. It is basically an increased amount of bilirubin in the body. Bilirubin is a product made by the breakdown of red blood cells, as you all know. So the newborn's liver might just not be effective enough at excreting this, and that causes the buildup of bilirubin in the infant's body. So it will improve. It can last anywhere from 1 to 2 weeks, and you may notice a yellow tinge to the skin and eyes of the newborn. This all relates to the knowledge part of the framework, just knowing the background of what you're dealing with and what you're trying to accomplish. So types of treatments for jaundice in the newborn are phototherapy. So this can involve a Billy blanket if we're trying to increase skin-to-skin contact, which is recommended. We can recommend to the mother to use the belly blanket instead of the traditional method. So this will really encourage skin-to-skin and help with breastfeeding. We can encourage the babe to be skin-to-skin with the mother or attempt at breastfeeding. 8 to 12 feeds a day is recommended to encourage the excretion of bilirubin. The infant will have more bowel movements, and that will encourage the excretion of the bilirubin. So that's really helpful. We want to feed often. We want to get that baby to the breast. We want the mom to be producing milk. The baby may be sleepy, so you really want to undress the baby, get the baby close to the mom to stimulate the baby to feed. Time, patience, and reassurance are all very important. Just reassure the mother. If the mother or the baby is getting frustrated, try again another time. Let them both settle down. It can be a really stressful time for them. So observations we can make as to whether the jaundice is improving is the improved skin color. The baby may not appear so jaundiced. The bilirubin level would be improving. The weight, there wouldn't be a significant weight loss, so you want to aim for less than 10% weight loss. Output, is their urine, is the baby mecking? How is the latch? How is the milk transfer? If all of that is going good, then you can